So we're going to have a little sort of interactive sort of quiz. So first question, picture round. Which of these are mast cells? 1, 2, 3, 4, 5, 6. And the time starts now. Right. Question number 2. Multiple cutaneous mast cell tumors carry a worse prognosis. True or false? What is the most sort of common site of metastasis for canine mast cell tumors? A, spleen, B, lung, 3, liver, D, regional lymph nodes. Next one. Which of these is the correct breed combination for best worst prognosis? A, Boxer Sharpei, B, Labrador Sharpei, C, Pug Sharpei. Number 5. Which of the following locations carry the best prognosis? A, muzzle, B, thorax, C, prepuce. Number 6. A normal spleen liver sonographic appearance confidently rules out metastatic disease. A, true, B, false. Number 7. Which compound released by mast cells is mainly responsible for gastric ulceration associated with mast cell tumors? A, serotonin, B, histamine, C, dopamine, D, heparin. Number 8. Subcutaneous mast cell tumors carry a worse prognosis. True, false. Number 9. Which proliferation marker is commonly evaluated immunohistochemically to help predict behavior in canine mast cell tumors? A, S100, B, Ki67, C, cytokeratin, D, vimentin. Okay, last one. Which gene is most commonly mutated in canine mast cell tumors? TP53, BRAF, MYC, c-KIT. So next round, lymphoma. Which is the most sort of common anatomical form of canine lymphoma? A, mediastinal, B, gastrointestinal, C, multicentric, D, cutaneous. Number 2. Which is the most sort of common anatomical form of feline lymphoma? A, mediastinal, B, gastrointestinal, C, multicentric, D, cutaneous. Number 3. Which of the following is considered a negative prognostic factor in canine lymphoma? A, B-cell phenotype, B, T-cell phenotype, D, substage A, D, hypercalcemia absent. Which anatomical form carries the worst prognosis in canine lymphoma? A, multicentric, B, cutaneous, C, intestinal. Number 5. Cutaneous lymphomas usually are A, T-cell, B, B-cell. Number 6. If a dog with lymphoma is classified as substage B, does it mean A, the dog is sick, B, the dog is well? Which paraneoplastic syndrome is most commonly associated with T-cell lymphoma in dogs? A, hypoglycemia, B, polycythemia, C, hypercalcemia, D, myasthenia gravis. Number 8. Which chemotherapy protocol is considered best practice for a naive canine multicentric B-cell lymphoma? A, LOP protocol, B, L-asparginase plus lomostin, C, CHOP protocol, D, rabaphosidine single agent. Number 9. What is the median survival time of a dog with multicentric lymphoma treated with a CHOP protocol? A, 5 to 8 months, B, 10 to 12 months, C, 15 to 20 months. And the last one. Which diagnostic test detects chronality of lymphocytes and helps distinguish lymphoma from a reactive hyperplasia? A. Flow cytometry. B. Immunohistochemistry. C. PCR for antigen receptor rearrangement. D. Western blot. Okay, third round. Osteosarcoma. In which breed would you more likely diagnose appendicular osteosarcoma? A. Labrador. B. Greyhound. C. Chihuahua. Number 2. Pulmonary metastases are present in 90% of dogs at initial presentation, but what percentage is visible on radiograph? A. 90%. B. 30%. C. 10%. Number 3. Does chemotherapy following amputation improve survival time? A. Yes. B. No. Number 4. Which phrase is commonly used to remember the most frequent locations of appendicular osteosarcoma? A. Above the elbow, below the stifle. B. Away from the elbow, towards the knee. C. Above the stifle, towards the elbow. D. Toward the shoulder, away from the hip. Number 5. Which is the location associated with the worst prognosis? A. Proximal humerus. B. Distal tibia. C. Distal radius. Number 6. Which of these parameters is associated with the worst prognosis? A. Elevated ALP. B. Elevated ALT. C. Elevated bilirubin. Number 7. Do axial osteosarcoma behave in a less aggressive fashion compared to appendicular osteosarcoma? A. Yes. B. No. Number 8. Do soft tissue osteosarcoma behave in a more aggressive fashion compared to appendicular osteosarcoma? A. Yes. B. No. Question 9. Do feline appendicular osteosarcoma behave in a less aggressive fashion compared to a canine appendicular osteosarcoma? A. Yes. B. No. And number 10. Which chemotherapy drug is most commonly used as an adjuvant therapy after limb amputation for appendicular osteosarcoma? A. Vinblastine. B. Cyclophosphamide. C. Carboplatin. D. Doxorubicin. Okay, finished the round. So next is a medley sort of round. They're all a bit of a mixture, you'll sort of see. So name the country with the highest human cancer incidence rate. A. USA. B. Australia. C. France. Number 2. How many copies of P53, which is a tumor suppressant gene, do elephants have? Hint, man has 1. A. 10. B. 1. C. 20. Number 3. How many cancer cells do we produce each day? A. 50 to 100. B. 100 to 500. C. 200 to 1,000. Number 4. How many hot dogs do Americans consume in 1 year? A. 1 billion. B. 20 billion. C. 10 billion. Number 5. In what species has cancer never been found? A. Koala. B. Naked mole rat. C. Reindeer. Number 6. Apart from canine TVT, what other species has a directly transmissible tumor? A. Opossum. B. Tasmanian devil. C. wombat. Number 7. Name the 3 countries outlined in red with the highest human cancer mortality. Number 8. How old is the earliest cancer description? A. Middle Ages. B. Ming Dynasty. C. Ancient Egypt. Question 9. How many years in life expectancy would you gain if you quit smoking at 30 years of age? A. 10. B. 5. C. 3. And the last one. So in a nationwide survey, 113,000 doctors were asked, what cigarette do you smoke, doctor? The brand name mostly was A. Camel, B. Marlboro, C. Gauloise. Right, okay, well done. So let's sort of do some scoring sort of now. Should we go? Let's go with the answers then. So question 1, which of these are mast cell tumors? The answer was D. Question 2, multiple cutaneous mast cell tumors carry worse prognosis? Obviously not, false, B. Question 3, what is the most common site of metastasis in canine mast cell tumors? Regional lymph nodes. Question 4, which is the correct breed combination for best worst prognosis? Is C. Number 5, which of the following location carry the best prognosis? Thorax. Number 6, normal liver and spleen sonographically rules out metastatic disease. False. Number 7, which compound is released by mast cells? Is histamine. Number 8, subcutaneous mast cell tumors carry a worse prognosis? No. Number 9, which is proliferation marker is commonly evaluated? It's Ki-67. And question 10, which gene is most commonly mutated in canine mast cell tumors? Is c-KIT. Which is the most common lymphoma? Most common lymphoma is multicentric. Which is the most common in feline lymphoma? Gastrointestinal. Which is the negative prognostic factor in canine lymphoma? Is T cell. Which location carries the worst prognosis in canine lymphoma? Intestinal. Cutaneous lymphomas usually are T cell. If a dog with lymphoma is classified substage B, the dog is sick. Which paraneoplastic syndrome is most commonly associated with T cell lymphoma? Hypercalcemia. Which chemotherapy protocol is mostly used? CHOP protocol. What is the median survival time of a dog with multicentric lymphoma treated with CHOP? 10 to 12 months. And which diagnosis test detects chronality? Is C. Osteosarc. Which breed would you more likely diagnose appendicular? Greyhound. Pulmonary metastasis present in 90% of dogs, but radiographically only in 10%. Does chemotherapy improve survival time? Yes. Which phrase is commonly used to remember the most frequent locations? B. Away from the elbow towards the knee. Which is location associated with the worst prognosis? Proximal humerus. Which of these parameters is associated with the worst prognosis? Elevated ALP. Do axial osteosarc behave in a less aggressive fashion compared to appendicular? Yes. Do soft tissue osteosarc behave in a more aggressive fashion compared to appendicular? Yes. Do feline appendicular osteosarc behave in a less aggressive fashion compared to canine? Yes. Which chemotherapy drug is most commonly used as an adjuvant therapy? Carboplatin. Medley. Country with the highest human cancer rate? Australia. How many copies of P53 do elephants have? 20. How many cancer cells do we produce every day? C. How many hot dogs do Americans consume in a year? In what species has cancer never been found? Naked mole rat. Apart from canine TVT, which other species has a directly transmissible tumor? Tasmanian devil. Name the countries. So Hungary, Mongolia, Zimbabwe. How old is the earliest sort of cancer description? Ancient Egypt. How many years do you gain? 10. And the last one? Which brand? Camel.